Good afternoon, everyone. Greg Mackling with you from 680 CJOB's The Start. It's my honor and pleasure to be with you again for this edition of the Health Report 2.0 for the next 60 minutes. We're going to speak with a leader in medicine in conversation with you, our friends, the Friends of St. B. On behalf of St. Boniface Hospital Foundation, I hope you are in good health. It's been a difficult several weeks for many folks in our community. Again, here we are. Hope you're keeping warm on this frosty day. I had two vehicles which wouldn't start for me this morning. Not one, but two. So if I look a little frazzled, that's just the leftover from early this morning before I went on the air at 6 o'clock this morning. We've enjoyed a nice deferral on winter, but it's here now. If you were listening this morning, you will know that the overnight low, the forecast for tonight is minus 35, minus 45 with the wind chills. So good luck with all that. Do not, and this is as much a reminder for myself, do not forget to plug in your car tonight. Let us begin the formal part of our program this afternoon by acknowledging and reflecting on the significance and the history of where we are gathered. We live and work on Treaty 1 territory, the original lands of the Anishinaabe, Cree, Oji-Cree, Anishinaabe, Dakota, and Dene peoples, and the homeland of the Red River Métis Nation. We acknowledge that these nations were the first to protect and care for this land, and today we very much benefit from that. We respect the treaties that were made on these territories and acknowledge the harms mistakes of the past, recognizing that we are all treaty people, let our presence and actions today on this sacred land in some way contribute to a more loving and compassionate world where we all dedicate ourselves to move forward in the spirit of reconciliation and collaboration. Today, December 6th, also marks the anniversary of the 1989 École Polytechnique massacre. On this National Day of Remembrance and Action on Violence Against Women, we mourn those lost and strive to achieve a Canada free from gender-based violence. Today, how do the nutrients in certain fresh foods prevent or even reverse vision loss? And how can we help ensure more Manitobans have affordable year-round access to such, let's call them functional foods? Our guest is working on answers to these questions at St. Boniface Hospital. Dr. Miyoung Suh is a principal investigator in two distinct research sections. One is the Division of Neurodegenerative Disorders, and the other is the Canadian Centre for Agri-Food Research in in Health and Medicine. I'm going to do that again because otherwise the acronym doesn't work. Canadian Centre for Agri-Food Research in Health and Medicine. That's the DND for the first acronym, and CCARM is the shorthand for the second. Dr. Suh is a professor in the Department of Food and Human Nutritional Sciences at the University of Manitoba and a registered dietitian. And earlier this year, she received St. Boniface Hospital Foundation's Ronald Duhamel Innovation Fund Award. Now, a few quick housekeeping items before we get on with our discussion this morning and this afternoon. Dr. Suh and I will talk for about a half an hour, then we'll have about 15 minutes or so for your questions. And as a viewer, your camera is off and you are on mute, but you'll be able to type your questions in the chat box at any time. I think it's on this side over here of your screen. We'll get to as many of those questions as our scheduled time allows. So without further ado, please join me in welcoming Dr. Miyoung Suh. Dr. Suh, good morning, good afternoon.
Good morning, Greg. Thank you for the kind introduction. It's my pleasure to talk to you and the audience.
Well, I'm stuck in the morning because that's where I work. That's where I spend most of my day. So I promise to do my best not to call this afternoon this morning. So, this is, as we mentioned off the top, maybe our first real winter day of the year. Did you grow up in Winnipeg?
No, actually, originally I'm from South Korea, but my first degree, I did my PhD at the University of Alberta. So
you know
it's
about
colder than here. So this cold, I sometimes I love it. This very harsh cold. I love this winter, and it snows. Yeah.
Wonderful. Well, then hopefully that means we can keep you in Winnipeg for a long time to come.
We will see.
So over my years of association with St. Boniface Hospital and the foundation, I've had the pleasure, gosh, I can't even count the number of researchers and the talented scientists I've had the honor to not only interview, but to get to know very well over the years. And the work taking place in the Albrechtsen Research Center with the support of donors is not only incredible one-on-one, but it has far-reaching implications beyond the walls of that institution, and of course into our community and around the world, as it turns out. So I want to get into your specific projects in a moment, but I mentioned earlier that you're a principal investigator in two research sections, DND and CCARM. So maybe you can do something for us and connect the dots for our audience on how your work is at the intersection of these two areas, and maybe broadly, in a broad sense, maybe you can tell us what kind of mysteries you and your team are working to understand a little bit better.
Thank you for asking. Nobody asked me actually how come I am involved in two sections, but thank you for the question. First, to start with, I want to say that I'm very lucky to work in those two divisions, since only 3 researchers are at the research center are cross appointed in different sections. So my students get opportunity to get access to those, 2 floors, and like a significant amount of work we can do it with the 2 sections. And in DND, we are studying various neurodegenerative disorders, such as brain degeneration in Alzheimer's, cognitive disorders, and or diabetic associated neuropathy. And we all working on how medications or nutrients can prevent and treat those neuronal disorders. So my research fits into, the other people in the DND, they are looking at the neurodegeneration stage, but we are looking at the neurodevelopmental stage, such as the fetal brain or the retina, how they developed during pregnancy when mothers are drinking alcohol. So probably you heard about the fetal alcohol spectrum disorders. So how alcohol affect and then how the nutrients are affecting it, and for normal development of the brain and retina. That's what we are looking at. In CCARM, we are all dedicated to investigate the potential health-related benefits found in the food, functional food, natural health food, and so on. So my research is always looking for how nutrients we consume are metabolized in our body and then function, such as, of course, my love of tissue work is a brain and retina. So I saw the many evidence that our cell membrane is changed by diet of what we provide. So basically, you eat what you eat is what you are, as we commonly said. So these are my connections being in the 2 divisions.
It's fascinating. You were on the radio with us yesterday morning, and my co-host Loren McNabb said yesterday, every time we have these discussions about functional foods, she finds it fascinating how all these things that our grandmas and our mums and our grandpas and our dads told us about, you better eat your vegetables. And there was always some sort of underlying word of wisdom attached to that. And ultimately, it's not just propaganda, there's something to it.
you know what? It's interesting that what you said is that grandmother is correct. Only that we don't have a scientific evidence. That's what we are here to show, the scientific evidence that grandmother is correct.
We're proving grandma's right. That's got to
Yeah.
go on a poster or something somewhere, I think, somewhere down the road. So let's talk about this eyesight situation. I'm one of these guys, right? You have glasses as well. But there are obviously people who have much greater issues with regard to their vision. One of the focuses you have happens to do with the retina and people with diabetes, right? That's a degenerative situation over time, as I understand it, as it pertains to diabetes. What are you theorizing, and what have you learned so far with regard to the development of the retina, or what happens to the retina with regard to those with diabetes?
So I mean, diabetic retinopathy, probably people heard about it. This is a big issue in diabetic complications. So too much sugar in the blood leads to the retina damage over time. And retina is a so tiny tissue located at the back of the eye. And it has the highest polyunsaturated fatty acid, means that it's easily oxidized. More poly, then more oxygens can get in. So retina is easily get oxidized. So lifetime that we are bombarded with the light hitting the retina, and of course towards the end of older age, and then you get the retinal degenerations, right? Or if in diabetic conditions, even it gets worse. But good thing that we can protect that we call well, another way that diabetic retinopathy can be worsened very quickly when we don't have enough macular pigment. So macula is the central part of the eye, and then just behind of the macula, there is a very light color of pigments. Okay, this pigment, if it's thicker, then it's more protective for the eye. Okay, so this macular pigment is composed of a certain types of a carotenoid. It's called lutein and zeaxanthin. So many animal studies show that these carotenoids are important in providing protection. So in terms of food-wise, when you talk about not the regular eggs, but eggs enriched with the lutein, that become a functional food. Or egg enriched with called the DHA, that's a structural component of the retina. So those kind of a functional food, and also many type of dark colored, fruit and vegetables, like such as kale and spinach, can be beneficial for this type of protection. So in terms of the northern communities, that's one of my projects. Nearly half of the adults in some northern indigenous communities, the adults populations, are diabetic. 50%, that's a huge prevalence. And significant visits to ophthalmology office, it's actually happening because of the eye issues in northern communities. So it's my hypothesis is that not only diabetic retinopathy, but by eating less fresh vegetables, they make retina macular pigment thinner, and then that leads to the more retina damage. Okay, variety of reasons it could be because they don't have access to the food and they cannot grow fresh food. It's too expensive, or they have to rely on transportation all the time. So many reasons they consume less. Anyhow, so we purchased the two instruments that allow to measure the thickness of the pigment and the retina function. So as a screening practice, we go there, we can screen the people, and what we can measure is what we can aim to manage, right? For the especially working in the St. Boniface Hospital. And we are working on nutrition strategies because I'm from the nutrition background. So we are looking for nutrition strategies that might prevent or reverse the retinal damage.
So obviously, nutrition is plays a big role in diabetes overall, but then when you narrow it down to the construct of the retina,
Mhm.
this is where your research comes in, and how your research might indicate the different diets that might be able to not only prevent and stop this from happening, but actually reverse what's already taken place with the retina. Is that right?
We like let's just focus on like we can with the nutrition, in pharmacology in here that they use a lot of medication to treat immediately. Foods, it gets metabolized and get to the right tissues. It takes time. So if we started early, and it's a prevention is first, and then certain conditions that we may reverse or the maintain what I should say, not to further damaging the retina. That's what we
Okay.
can say. Yeah.
Okay, fair enough. So fresh produce, I think we're feeling the pain of inflation across across the board, fuel, shelter, clothing, but eating healthy is especially important. And it's becoming increasingly expensive no matter where you live, never mind in Canada, maybe around the world. So it's a greater obstacle for communities further from the direct sources. I know that part of the big part of our food inflation right now has to do with not being able to get fruits and vegetables from our normal sources from it. So it's coming from further away. Tell us about another one of your projects addressing these needs at the source or where they're needed.
I agree, the food crisis, and I myself have to budget well for grocery shopping for healthy eating. In terms of northern communities, fresh food accessibility is indeed a huge issue, right? So luckily that I get involved in a smart vertical farm for health projects. So this smart vertical farm it's a computer assisted vertical indoor farm. They can grow a variety of vegetables, herbs, and medicinal herbs and fruits and so on, providing the community with a fresh and affordable vegetable year round. So it's a really cool and high agriculture technology. I can sit in my office and manipulate the growing conditions because everything is, computerized. So this is a really cool system. Even I myself and visit that, smart vertical farm. This is a wow. This is a really the miracle things will happen in northern communities, right? So the pilot test that they have shown that the smart vertical farm produce, they send us a sample that they grow, and then compared to the grocery store purchased vegetable, and several key nutrients are much richer in their produce. So that was really the amazing that is finding these results. So
Even richer than what you get off the store shelves. It's more nutrient rich or nutrient dense.
Yeah, so we compared with the two different values. So one is a grocery store purchased one with their produce, the smart vertical farm produce, and we also have a Canadian nutrition Canadian nutrition file that has published by Health Canada, have all the list of the vegetables and food that it's a certain nutrient types, what concentration should be, and compare with the dose, and this one is either all compatible or slightly even higher.
Wonderful, that's great.
Yeah.
One of our participants today is asking if supplements can help pick up some of the slack if you don't have access or the economic wherewithal to be purchasing fresh vegetables. Can supplements do some of the work that fresh vegetables might otherwise do, Dr. Suh?
Yeah, I mean, as a clinical dietitian, we always promote as a consuming as a food and a function.
Sure.
I mean, the food as it is instead of a supplement. But when conditions like in northern communities, if they don't have that access of a fresh food, then at least a food supplement, not the supplement with the like supplemented in the pill form, right? That's what
Right.
we are gonna recommend at least.
So talk about the relationships required to work. I know that they're doing vertical farming in the middle of the desert in the UAE and in Kuwait and all these places
Yeah.
that are in the middle of nowhere. So it only makes sense that we could do it in northern communities here. Are there any barriers there, or what sort of work do you have to do in terms of collaborating with the different levels of government, maybe First Nations in northern Manitoba?
First of all, working with the indigenous communities or the First Nation reserves, it's not easy. And it took for me almost 2.5 years to contact them and then a meeting with them. And then finally, they opened the door for us to research together. So it's trust is the big thing between researchers and community. So it's not easy. But then once you show that you build that trust, then study can be done together. It's not from only the university side or the hospital side, but together work with the community that will really make it work. So I have a good relationship with one of the community. It's called the Opaskwayak Cree Nation, located in the park. So currently, I am a research liaison with this community. This community has established the smart farm, and we are working towards developing together with them, like not with only the university side or the hospital side. You're going to develop functional vegetables. So they show that all the evidence of growing typical vegetables and some fruits and so on. But we want to build above of those. So we're going to develop functional vegetables, which means that it can be enriched in the phytochemicals against diabetes or other metabolic disease, right? So they can produce high value produce, and then year-round accessibility to the community members. And then if they consume more and more, and also generate, consume more, then it'll be health benefit, and then economic benefit as well, because they can have a better business.
So would this be like a partnership with Opaskwayak Cree Nation? And yeah.
Yes, it's a partnership together.
Yeah, and that's critical. I helped build a telecommunications company with the First Nation in Alberta about 20 years ago. And it's funny what you say about trust. I can remember one of the members of the board sort of saying, when we first met you, we were unsure about you because we've been taken advantage of in the past by other folks trying to come and sell us these grand ideas. But you've earned our trust. And so that goes a long way, I think, in terms of also getting the buy-in once everything is developed. Now, are you going to get the community to embrace what's being produced in terms of the food? That's going to be important, isn't it, Dr. Suh?
Yes, it's definitely that. It's so now we get a lot of we are working with the Opaskwayak Cree Nation Health Authority as well too, so that we can have a certain type of the health monitor. And we are also doing fetal echo spectrum disorder study that what pregnant mothers are consuming during pregnancy. So those give us our basic data. Then we can have emphasize a certain type of vegetables or food that they can I mean, the baseline is that what mothers are consume at the moment with the drinking during pregnancy, if it's a certain one is lacking, then we can recommend it to the community. Your mothers can consume this type of a food because it's lacking during pregnancy and so on. So we are indeed that it's working very closely with the community and Smart Vertical Farm management team and Opaskwayak Health Authority.
It sounds fascinating. I would love to see it one day. And I can only imagine that this is just one step of many to help, our northern communities be healthier, be stronger, more independent in terms of food, because there's nothing worse than going to the store and not being able to get it, or have it double in price, from the time you bought it last to the time that you get it. So there would be a stabilizing factor, obviously, economically, in terms of the price of this product as well, because it's coming from a known source, just up the road, just down the street. So in 2022, sorry, Dr. Suh.
Sorry, no, it's also for the, training young generations. That's a huge thing too. So this is like a computer game. It's not like an open field working. So it's a huge for the, training younger generations, for the smart farm, and that they can generate this fresh functional vegetables year round.
Wonderful. So 2022, you received the Ronald Duhamel Innovation Fund Award. Innovation and leadership take many forms, especially during times of crisis and rapid change, which I think we agree we're all in the midst of right now. How did it feel to receive this donor-supported award?
I've been with the St. Boniface Hospital since 2009, went back to the main campus and then come back again 2017 and so on. And I've seen this award recognize some truly very high impact research. So I was so flattered to be nominated by the D&D director, Dr. Paul Boniface, and I said, I'm not sure. And at the end, anyway, and I learned that I was receiving this award. I said, really? I got it? Kind of a response, right? But indeed, I really appreciated the nomination and the St. Boniface Hospital Foundation Selection Committee for recognizing my dedicated work in this field.
We were discussing on the radio yesterday the idea, just briefly, of CCARM, and not only what it can do in terms of our health, but the benefit to the Manitoba economy overall by identifying functional foods that are grown here, that can be processed here, and then maybe can be shared with the world. We're seeing lots of examples of that right now, of Manitoba foods making a genuine difference around the world. Does that come up in a lot of conversations when people are trying to decide whether or not to fund research, whether it's yours or others in the building, Dr. Suh?
I see that a lot of interest from the industries as well as First Nation communities and other researchers regarding this smart vertical farm projects. So they wanted to know about the technology. They wanted to see the potential of economic benefits, of course. And my side is I'm always looking for the health side, because it's my training that how we can treat patients or people with metabolic disorder conditions or diabetic conditions, how I can treat with this fresh food. So a lot of interest in all over. So I'm pretty busy at this moment to deal with everything, but it's really good busy, like good. It's so.
Well, the impact on diabetes alone in Manitoba with regard to our healthcare budget, which is always strained, this has a real opportunity to have an economic impact with regard to reducing the number of people getting diabetes in the first place. So, that's obviously part of the discussion, part of the process and the buy-in for some folks. And also, I think there's also that whole question of payoff when it comes to research. It's just the way it is. People want to know that there's going to be one at some point in time. So how do you talk to a donor who wants to understand the impact of their donation towards research when the quote unquote payoff might be 5, 10, perhaps 15 years down the road?
It's hard to answer, but I'm doing both wet lab and the clinical work for my research questions, and it takes time, right? Because we have to find the mechanisms of disease, and then you treat with the food or the certain nutraceuticals, and then whether that's working or not, then translated to that human work. It takes for longer time. However, this smart vertical farm project with the health benefits in the northern indigenous communities, especially diabetes, we can see the effect sooner than later. Really, that I can, I can see that it's a 5 years from, now on and so on. And they don't have to rely on transportation from the south. And they can grow right there and they can consume, on that, reserve in northern communities. So a lot of health benefit is right there. Only thing from my side is that I wanted to build that experimental unit of a smart vertical farm on hospital side here, right? Then we can do a lot of manipulations. We can grow a lot of functional vegetables, not only one type, and like we can have many different types. A certain one for the kidneys, certain ones for the heart diseases. We can manipulate a lot of light and nutrients, and we can grow them. So that's my wish list. But yeah, the payoff will be sooner.
Well, not everybody can get up north to see in person what's going on there. So if you had a replica down here that we could all see, that would obviously probably pique a lot of interest as well.
Yeah, that would be super. That will be my dream. Because we are driving 7 hours one way. So
right.
14 hours back and forth. And so it's a good experience for my students. Obviously, they're sitting in the lab. They don't know anything about the northern communities. By actually driving there, going there, and they see the facilities, see the First Nation communities, see the people are there. And it's a really experiential learning for our students. So I'm really pleased to do so. But then, to focus on developing more functional vegetables for the health, if we have one unit here, that would be super.
Yeah, well, and then they can see the impact. The students can see the impact of what they're working on and mission to a certain extent. And you mentioned transportation, and we've heard cautions with regard to climate change and how our winter road system is in jeopardy based on climate change. And so there's another impetus to really drive this project. If we don't have to take fruits and vegetables up north, if they can be grown there, that's obviously going to be a big deal for more than one reason, because it might be the only way that we can get them. Did you say that fruit and vegetables are an option with regard to this vertical farming?
So far that it's more vegetables, different light intensity required for the fruit. So they ordered a separate unit to grow the fruits. But my another dream is that this community is showing all the evidence that this smart vertical farm will work in their community. So if different community has a different, let's say that this one community focused on fruits, strawberries and other berries or tomatoes, and the other community focus on dark green vegetables and so on, they can swap, right? They don't have to rely on transportation. They can do it within sustainable in there, right? So, but at the moment, it's only one community has established this smart vertical farm.
What would be the difference, like when you're talking about the different it's ultraviolet light, yes, that's being used? Is it a different amount of electricity that it uses that would be the concern, or are you just trying to get the formula right with the water and the ultraviolet light for specific vegetables before going on to other things? Help us understand when you'll be able to maybe be able to grow other types of food. Functional
vegetables. Yes. So a lot of literature is showing that we can manipulate the nutrients at the media, and then also the light intensity that we can manipulate. And then it's a harvest time. We can also manipulate the light as well too.
At harvest time.
Yeah, harvest time when we harvest it. And then also that they show the evidence that it's a 3 to 4 days shorter growing kale compared to the outside. So that's already, economic benefits, right? So
Sure.
many benefits using this smart farm. And then I have a partner with Agriculture Agri-Food Canada plant scientists, so we can work together, because I don't know about the plant science at all, but we can work together. Definitely we can develop these functional vegetables
And then
for
there might
many
be
different type of diseases. Yeah.
well, and then ultimately there become benefits for other things that we haven't even imagined yet. And
Mhm.
that's the wonderful thing in my mind about being collaborative within the research and the different parts of not only the research center, but other research centers across the country and
Mhm.
around the world. How big is your team? One of our participants wants to know how big your team is, how many of
Oh,
them are
oh,
students?
I have a quite big, I don't know whether I should say big, but at least in nutrition, I have a quite big team. I have 3 postdoctoral fellows, and I have 3 PhD students, and 3 master students, and 1 undergraduate student. So
I
it's
added 10.
quite
Is that
busy
right?
lab. Yeah,
Is that
10.
10?
Yeah.
And then yourself?
And then yes, 11.
That's a pretty large crew. So
Yes.
that's wonderful. And can you give us an idea, just in general sense, are some of these students, are they born and raised Manitobans that might otherwise have gone off to the University of Alberta, the University of Texas? Like, is this attracting and keeping either young people here or young people from elsewhere to come to Manitoba and decide to do the research here and to work with you?
I've been very lucky to have students from Winnipeg, and they want to stay in Winnipeg. But I encourage them to, once they finish their PhDs, I encourage them to go away, because they can see some other experience in what other labs are doing. Then later they can come back to Winnipeg and then being a professional. That's what I always say that. But luckily I don't have many international students in my lab, but like I want to provide as much as wide experience based on my experience coming from the foreign countries, and then become academic member. So training is one of my strengths as well at the St. Boniface Hospital Research Center.
Yeah, that's wonderful. So if any of you who have joined us today have any other questions, we'd love to hear from you in the Q&A box. Don't do it in the question and answer box, not in the chat. I have no idea why that is. I'm just doing what I'm told. I'm very obedient, Dr. Suh. I would be a very good student. I'm a little bit too old now, but I always like to learn new things. And this whole entire thing is fascinating. One thing I didn't ask you is, how large is this facility up at OCN? How large is your farm?
Oh, the farm over there is I think it's 1,000 square feet. They use their veterans hall, and then in the corner they develop, but that side is about 1,000 square feet. But it's a layer, right? It's a vertical farm. So 4 layers they do have, and that's the size. But I think it's enough to provide vegetables to the community if we focus on the community.
What about water? How much water does vertical farming use versus our traditional forms of farming? Can you share that with us? Am I asking you a question you don't know the answer to?
Maybe I should ask directly to the smart farm, vertical farm management team there. But what I know is that this vertical farm system is 95% of the water is recycling. So one cycle goes to the vegetable, come back, and then they use the UV and they kill all other, bacteria or the fungus, and then they circulate it again. So they don't use a lot of water for this system.
It's its own little biodome, sort of,
Yes, yeah.
where the water gets reused over and over again. It's absolutely fascinating stuff.
Mhm.
What somebody wants to know, how vertical is the farm? So
The
would it
four,
be 10 feet high, 6 feet high? You said, did
uh,
you say 4 levels?
yeah, 4 levels. And the light source is right underneath, but it doesn't burn the leaves. So it's, if I want to encourage you to visit one time
It
to
would be
see this
amazing.
facility. That my first impression was really like, wow, right? And then they harvest the vegetable for us, and we taste it right there. It's a bit crunchy, and it just when you eat fresh vegetables, you can tell that it's oh, this is so fresh. That kind of feeling that you get immediately.
So what's next? What do you need to know? What do you need to learn in order to say, what would be the next step be for your research on this
That's
thing?
what I said. We are currently developing functional vegetables. So we are not going to grow normal vegetables. So now we know that all the evidence, right? So for their business, fresh produce, they can sell it to the markets, and then their restaurants, whatever they can do. But as a researcher, we want to develop more functional vegetables that against chronic diseases like the hypertension, diabetes, and so on. So that's the currently on the go. And then at the end of that, we have to prove that indeed that's working, right? For it's a bioefficacy that we have to test. So that's the currently that it's planned out.
So health claims are almost as difficult to prove as drug efficacy. There's a big process attached to that. Just for those that are with us, just give us an idea of how long that can take and how thorough that process might be.
At the moment that it's right next that it's planned out, it's January that we're going to do functional vegetable test in the animal model. So we make diet-induced obesity. So this is reflecting the human conditions, right? You have so many different models that animal model that you can use, diabetic animals or obese animals. But what we do is that we're going to use diet, certain type of diet formulation, make animals obese, and then we induce type 2 diabetes. So this is really the mimicking the human conditions developing type 2 diabetes. And then once this is approved, if we show that evidence of that improving diabetic parameters, then we will move to the human study. So we have a clinical trial experts in my lab as a team, and then we can actually do the human study. Indeed, that it's working for the human as well.
How quickly could you be recruiting people from the community for a human study? Is that an 18, 24, like how far away once the study on the animals is done?
Animal will be done within 5 months because it's already all planned. We get all the human ethics already, and only the funding is running out soon. That's my nervous. So Agriculture Manitoba is a funding for my animal study as well, and that's ending soon. And however, with the ethics done and everything, so the animal study, at least we will get some results by May and then June. Then we can start the human study. Then it will take another 2 years or so.
I feel your excitement.
Yes.
Sense your excitement on this. The finish line.
That's why I'm here.
well, then you know what? If we've ignited some passion within the community about this that mimics yours, then I have no doubt that we'll be able to help you get this to the finish line. Dr. Suh, I want to thank you immensely, not only for your time today, but the efforts you're taking in order to deal with something that's critical in our province, critical for almost all Manitobans. And thank you for your passion.
Thank you. It's my pleasure to be here.
We'll let you go now.
Okay,
So
thanks.
thank you. That concludes our program today. I want to thank everyone for sticking around, your questions, your involvement in this, and for being a part of our Health Report 2.0 series. Once again, thank Dr. Suh for sharing her expertise, and thanks to our friends at Bounce Design for producing today's events. And on behalf of St. Boniface Hospital Foundation, I can't believe we're here this time in the calendar again, but I wish you a good afternoon, happy holidays, and believe it or not, a prosperous new year. It's less than a month away. We look forward to seeing you again in 2023.